Hi, I'm Farhana Shahid, an incoming PhD student at Cornell. Today I'm very excited to share about our recent work on dengue epidemic in Bangladesh. Our paper is titled Learning from Tweets: Opportunities and Challenges to Inform Policymaking During Dengue Epidemic. The novel coronavirus pandemic has captured our attention throughout the year. Infectious diseases have been around us all along. Dengue is a mosquito-borne infectious disease that ravages the countries worldwide almost every year. In 2019, dengue infected the record highest people across the globe. However, the low-resource countries are hit hard in the face of such infectious diseases. Poor government infrastructure, poor access to government health data complicate this crisis response plan within low-resource communities. Even social media-based disease surveillance is difficult within these regions due to low internet penetration and poor adoption of social media services. In the face of these challenges, we turn our attention to the 2019 dengue epidemic in Bangladesh. Through our work, we address two research questions. What can dengue-related tweets reliably tell us about the public health issues in Bangladesh, and how Twitter data can guide public health policy for dengue epidemic in Bangladesh? To find answer, we collected around 28,000 dengue-related tweets in the context of Bangladesh using TweetScraper. Then we applied by-term topic model to identify the topics that captured public attention during the epidemic. Besides, we used different text mining techniques to extract information about locations, hospitals, number of dengue cases, and blood donation requirements for critical dengue patients. In addition, we collected dengue-related data from government health reports. For more details, please check out the methods section of our paper. Our analysis revealed several interesting observations. For example, for some areas, we found Twitter data reported more cases of dengue than that of the government reports. When we looked into the sources of these tweets, we found they were reported from the Twitter accounts of local news and print media. Besides, by analyzing the tweets, we observed a significant rise in the cases of dengue following Eid al-Azha, which is one of the largest religious festivals among the Muslims worldwide. During this time, people travel to celebrate Eid with their family members and relatives, and with people, infectious diseases travel too. Moreover, we found women died more of dengue than men, and when we analyzed the blood donation-related tweets, we observed significantly greater demand for Rh-negative blood groups during dengue epidemic than that of the non-epidemic period. Apart from this, there are other interesting findings from our work. To learn more, please have a look at your main paper. Now, if you think about the implications of these findings, then in many cases, Twitter data can reveal the shortcomings in government health reports. Given the scarcity of resources within low-income countries, there are often cases of underreporting for the rural areas. However, integrating and verifying information from trusted news media can give us a better picture of the epidemic across the country. Besides, our findings reveal high transmission of dengue following Eid. Now, it's difficult for the government to restrict travel during Eid given the sensitivity of the religious context. However, the government can strengthen cleanliness measures at bus and railway stations because a recent government survey revealed high density of Aedes vectors at these places. Besides, public awareness should be raised so that symptomatic people avoid travel during this time. Moreover, dengue-related tweets can reveal the local areas that are highly infected, and such low-level data are usually missing in government reports. Government can utilize this data to reallocate its limited resources to highly infected areas. Our analysis of personal blood donation requests on Twitter suggests that blood banks should focus on the reserve of Rh-negative blood groups during dengue epidemic. Besides, public narrative about dengue on Twitter reveal several shortcomings in dengue diagnosis and treatment facilities. This can help the government identify areas for improvement and regulation. This is all from us today. If you have more query about our work, please feel free to reach us either during discussion or via email. Thank you.